All right, it is time to open the "Is my staff member truly an independent contractor?" conversation. It's a big one in the physiotherapy world, in the allied healthcare world, in the private clinic world. This conversation has been in the zeitgeist or in the lexicon since I can remember. I remember even being a student and this conversation being a real thing. So before I even dive into it, I think it's important to put a bit of a disclaimer on this one. I am not a lawyer. I am not an accountant. I don't work for the CRA. I don't understand the inner workings of how an audit works when the CRA does do a tax audit on a clinic. That said, I am looking at this with the lens of a clinic owner and a consultant. And that said, there's a lot of nuance in this conversation. And as I'm about to explain, the CRA doesn't define this in one particular way. It is kind of an overview of the entire relationship. So, with all that said, take this all in, reevaluate what you're doing, or if you're about to open a clinic, have a conversation with yourself about what you want this to look like. Take all this information in. And when it comes time to draft up your employment or your contractor contracts, have a chat with someone who can dot those I's and cross those T's really, really well, professionally, legally, and, with the right accounting background. So that's my disclaimer. It's out of the way. Off we go. So, the Canadian Revenue Agency, the CRA, our favorite three letters in the working world, the CRA looks at the entire working relationship of your staff member to determine whether they're an employee or they're self employed as an independent contractor. So, they look at the entire working relationship. And we're going to try to break this down into as many of the parts as possible through this entire episode. So, please stay tuned because, again, lots of nuance and lots of little itty bitty pieces to this that are going to build into the entire relationship as it is whole. So, some of the key factors here include does the staff member have control over how or when their work is done? Do they own any tools? Do they have any financial risk? I.e., do they stand to lose money if, the business isn't working well, or do they profit if it is doing well? And, how integrated into the team or the business are they? There's kind of like this optic piece that comes to it. So, those are the things that we're going to discuss today and look at it through that lens. This is a really important conversation right now for a couple of reasons. The first of which, the CRA is actively auditing clinics. This is not something that just like happens to your neighbor and it only happens to other people. Just because other clinics have been audited doesn't mean that your clinic might not be or my clinic might not be, right? Like this is something that we can't just sweep under the rug. I know a lot of clinic owners who are like, yeah, it's something I should look at, but like, there's many other pressing things or fires to be put out. And so it just doesn't happen until it needs to happen or it's too late. So this is something that I would really suggest having, a conversation with yourself and your staff about like ASAP. Because misclassification, if someone at the CRA audits you and decides your staff members are actually more employees than independent contractors, that can mean a lot of money for both you and your staff member. You might get charged with like some huge tax penalties and paybacks, EI, CPP, just it could just create a whole headache and quite frankly, pain in the ass for you in addition to the financial ramifications of this. So definitely something that's worth looking into. As far as I understand, the CRA has been recently ramping up their audits of the healthcare private world again. I know of clinics in the past who were hit hard, and that was around the time that the employee model became more popular. And things seem to be ramping up again right now. Whether AI is a factor in this, I'm not entirely sure, but it's something that we have to be really cognizant of. So, the other big piece of this too is a lot of clinic owners choose this not only because everyone else just does it, and that's how it's kind of been in the physiotherapy and allied healthcare world, but because it's like super easy when it comes to payroll. Like if you have a 60-40 split with a practitioner, that's a Jane report that you pull, hack read in Jane. In fact, you can like put your fee splits and it'll spit out the compensation that you owe them. Boom, payroll, off you go. That looks very much like an employee model when you're the one pulling the reports and sending off payroll. The actual contractor should be invoicing the clinic or actually collecting payment themselves and paying rent. We will dive into that. So ultimately, just because it's easier doesn't mean it's the right way to do it. And the reality is the CRA doesn't actually care what you call your staff members. They care about the working relationship and what that looks like as a whole. So let's dive into it. So I'm reading through their stress test, right? Like there's actually some questions that the CRA has and these 6 categories that they look at, and these all build into the whole and the whole of the relationship that they evaluate. So the first category that they look at is around fees and billing. So a proper independent contractor sets their own fees. They do their own invoicing to the patient or to the clinic. Sometimes they use their own merchant system. So they may have their own Jane account, or maybe within Jane, they have their own Jane payment system. So then that way they're the ones receiving the money, and then they either pay rent to the clinic, or if the clinic is the one collecting it, then the staff member or the independent contractor really should be invoicing the clinic for their portion of what they billed. It shouldn't be the clinic collecting the money and then setting the fees, controlling how the billing works, and setting the payroll schedule. That's way more of an employee model when the clinic owner sets the fees and there's no flexibility within that, and they are the ones collecting the money, and then they run payroll, they pull the reports, and twice a month or once a month they pay the staff out. So when the staff member has like literally no exchange of money or invoicing or billing except for just receiving money in their bank account once or twice a month, that's more employee territory. So a true independent contractor oversees the exchange of money, especially when it comes to the client. So if you are going to maintain an IC relationship, you really should encourage your ICs to set their own rates, collect their own bills, submit their own invoices, and allow for their own fee variation. Like maybe they want to do an acupuncture surcharge or have, an upped fee because they've taken more education. If they're a true IC, they should be able to do that without any sort of like conflict or issue from the business. That is fees and billing. The next piece of this is time. So your schedule, time off, vacation. A proper independent contractor should be able to choose which days and hours they work. They should be able to take vacation whenever they want to, and they should not need approval from the clinic owner. So, I mean, obviously communication here is important. Like if they're not going to be there, continuity of care and, ensuring client-centered care is continuing and that the patients are still being looked after is just good clinical work. But from an actual employment standard, the independent contractor should be able to just tell the clinic owner when they're not going to be there versus having to like approve and get coverage and all these things. And from the fees and billing standpoint, or the risk piece that we're going to talk about, the clinic should not be the ones on the hook financially if that clinician decides to take a month off, right? Like the clinic should not suffer because they've taken time off. We will dive into that piece a little bit more. But when it comes to scheduling, the independent contractor should be able to choose which hours, put blocks in their schedule as needed without any form of approval from the clinic owner. So if you want to hire an independent contractor, that should be the expectation. If you have a staff member that is, being by the clinic's distribution told to work certain hours or that they must work certain days or there's a certain hourly expectation, they need to have permission for their time off, that's veering into more employee territory and might look a little bit gray on audit. So if you are someone who wants to have more control over your staff member's schedule, you want to know and approve their vacation time, you might want to look at more of an employee model. So if you want to keep it more in the independent contractor range, let them control their own calendar. Obviously, make sure they're communicating with you. That's important when you have a business relationship, B2B, no matter what. But If you want them to actually communicate their time off, it's gonna be more about collaboration over the client care versus, coverage in the clinic, right? So that's the lens that we need to look through for that one. The third category that the CRA likes to look at is equipment and supplies. A proper independent contractor is going to bring their own supplies. So things like their laptop, treatment tools, acupuncture needles. They're going to pay for their own continuing ed. They're going to pay for their own marketing. And this is a really interesting one because time and time again have seen clinic owners who hire independent contractors and then, post on forums or in Facebook groups asking, "Hey, looking for a recommendation for a marketing company to fill up my ICs." That's actually like completely inappropriate in this case. If they are a business owner, which an independent contractor truly is, they are responsible for recruiting their own their own clients. Really, truly, they should be responsible for the marketing. Now, of course, it's going to benefit the clinic to have clinic clients coming in, but in the true independent contractor model, they're being contracted because there's extra work coming in. And then if they want to maintain that, they then need to make the investment in the marketing. So that's a big, big part of this, having your own supplies. Now, a clinic can supply, a table and the gym space and the waiting area. That might be part of like the rent agreement within the contract. And rent is a piece that we're going to talk about here, financial liability and risk. And so those pieces might come as more of like a rental piece and using that. But the consumables and exactly, the marketing, the continuing education, this one starts getting into more employee territory when the clinic is the one supplying everything. They're supplying the K-tape, the acupuncture needles, they're paying for marketing, they are paying for absolutely everything. And all the physio has to do is basically just show up and see patients and get paid. That's not an independent contractor model. The independent contractor truly needs to have their own consumables and their own purchases on the regular to make this a true independent model. So, to keep it clear, having a rental agreement, obviously, percentage splits are a big piece of where the risk comes in and the payment for these things comes in. But when it comes to actually having supplies, a percentage isn't quite enough. Like there still needs to be a piece where the independent contractor has outward money to supply their business. So, table rental, gym rental, these things are going to be a little bit more like within the IC model, but consumables and, education, this kind of stuff and marketing really should be on the IC within that. So, that's how you can keep that clear, is having a rent model or, a percentage and rent hybrid type thing. But yeah, an independent contractor truly should have their own expenses that cost them money variably within their services. So this is the next part. Number 4, what they look like at is financial risk, and that ties into the equipment and supplies piece. So if they're purchasing supplies, consumables, and that's a financial risk, which is what we want to see. That said, that's a variable risk, right? So if they are using needles, it's because they use it in a session. And so the things that you spend money on, on a session by session basis aren't necessarily financial liability or financial risk. You're spending that money because you're earning that money in that scenario. Financial risk is where an independent contractor pays for rent. They absorb no-show fees, they market themselves, and they can profit or they can lose in the business model here. So the really big way of describing this is if a clinician decides to go on holidays, let's say they take the entire month off. Now, the overhead being carried by the clinic owner, if that clinician leaves for a month, now the entire rent, all the staff, all the overhead of that clinic is being carried by the clinic owner, and the clinician can just walk away without any form of loss or liability risk or overhead themselves. That's not truly a business owner. An independent contractor would have some form of financial liability if they are not bringing money in. So the classic fee split, 60/40, 50/50, or in some wild cases 75, 25, 20, 80. Please don't do those kinds of splits. It's crazy. In those models, they're just variable, right? Like the clinic owner takes a percentage of that. Great, cool. Yeah. Like that should also be a part of it. But if a clinician isn't working or takes a stretch of time off, they need to also have a financial liability to that. It shouldn't fall entirely on the clinic owner. And this is the one that trips people up often in the community because everyone just operates on a fee split. But then what happens is clinicians go away for 3 weeks or they go on a holiday or they get sick and they can't come to work. Guess who absorbs all the overhead? The clinic owner. The independent contractor doesn't have any form of liability in a classic fee split, which is incorrect. So if you are going to have an independent contractor, have a rental agreement or have a hybrid model where you have rent plus a split, or, make sure there is some form of investment that they have to make on a monthly basis or on a, yearly basis or whatever that is going to put some of the liability back on them. I really like a hybrid model where it's rent. So there's a base rent monthly. That way, you know, basic overhead is covered for the clinic owner, and then variables are split, right? So then, they can take 80% of their split, and then 20% is the added work or the added overhead that happens on a session to session basis. And the costs and financials of these things that can be broken down in another episode if this piece doesn't make sense to you. But an independent contractor truly needs to have financial liability in order to prove to the CRA they are an independent business. So make sure you have rental models or, a fee split and rental model piece or a fee for service on a monthly basis to make it look truly like there is a financial risk for the independent contractor. If all the financial risk sits with the clinic and, if the clinician is not billing any money and all the financial risk sits on the clinic owner, that's an employee model. So take that information and definitely mull it over, because I know there's a lot of scenarios and a lot of clinic owners that have independent contractor models that don't meet the financial risk model. Number 5, does the independent contractor have the freedom to work elsewhere? This is another really big one. We see contracts all the time where people are hired as independent contractors and then their ability to work within a 15-kilometer radius is like taken away through the contract. Like they have a non-compete, and, in an employment model that might work. But if they're truly an independent contractor, they can run their own business. They can work at multiple clinics. They can have their own practice on the side if they want to. They can go do home visits. They can work at the clinic. And as long as they're just paying rent or paying a fee for service in addition to rent for that, they really should be able to be mobile and work wherever they want to. Their ability to work cannot be limited in an independent contractor model. So it becomes employee territory when your staff members are restricted by a non-compete clause, or there's penalties for working at other locations, or they're, not allowed to work at other clinics or have their own businesses or have their own side hustles. If that's being limited in the contract, they're not truly an independent contractor. So if you, again, want to keep it independent contractor truly, you have to allow them the freedom to work elsewhere. And I mean, ethics are a big part of this as well. This is not a, exclusive conversation. It is, soliciting of patients and staff is a different conversation. Non-solicit agreements don't necessarily fit within here, but a staff member should be able to work elsewhere and have their own mobility and ability to work in other places. If they're soliciting clients and patients and staff members, that's perhaps a different conversation, but a non-compete really shouldn't hold up for an independent contractor. So lastly, the last piece here is, does your independent contractor have their own branding? This is the integration piece. Culturally, do they look like they're a part of your clinic, or do they look, optically like they have their own business and they just are facilitated, their business is facilitated in your space? So do they have their own branding? Do they have their own business cards? Do they have their own website? Or maybe they have their own Instagram account and have their own title or their own corporation or their own, messaging, and they just happen to operate inside of your space. This moves into employee territory when they are part of your staff and they have your branding, they're wearing your uniform, they're on your website, and it is totally indistinguishable from an optics perspective from an employee, right? Like if you show up, they're wearing your branding and and also you've given them that uniform. If they're wearing a uniform, first of all, that looks like they're culturally a part of your clinic. But then if you've actually given it to them, they've had no financial risk in acquiring it either, right? So that's very employee territory. But if they're appearing on your website and they have everything falls within your branding, their business cards are on your branding, that is definitely more employee territory. So a better model might be to make their independence more visible. Do they have their own branding, their own, do they have their own Jane account? Do they have their own business cards? And, are they marketing in a different way and using your space for their practice, right? So this one's a lot more nuanced and a lot more, kind of subjectively assessed, but it's really, really important. And again, I can think of many clinics and, when you look at clinics and you can't tell if they're independent contractors, that's kind of a gray area that's really important to look at. So those are kind of the six main areas that they look at. Obviously, there's way more nuance to this, like I said. And again, having a lawyer or an accountant look at your setup is really, really important. And while, a consultant like myself, I can absolutely look at this and we can chat about it and we can chat about what is a best fit for your practice and, come up with ideas and themes. Having someone who can dot the I's and cross the T's and go over it with a fine tooth comb who speaks legalese is really, really important when it comes to ultimately signing any form of legal document. So that's really, really important in the end with all of this. So big, big, big conversations here. And if you're about to start a clinic, this is a conversation that needs to be had, within yourself, within your legal team, your accounting team, your staff. Do not start a clinic until this has been fleshed out thoroughly as a conversation with your stakeholders. It's so, so, so important to start your clinic in the right way if this is how you're going to do it. So if you're a clinic owner, maybe you're a clinic owner now already and you want to review this, or maybe you're about to start a clinic, these are some things that you can do. First of all, if you own a clinic already, review your contracts. Review your contracts regularly. This is something that happens time and time again. You sign a contract and then next thing you know, 10 years pass by. The entire environment and legislation that we're operating and the terms and conditions with insurers have changed, and yet the contracts haven't. So check in on your contracts at least yearly, have a lawyer review them, and not a lawyer who isn't specialized in this. Don't have the family practice lawyer review contract law. Have an actual contract or employment law lawyer look at these things, make sure this is their area of expertise and competence. And do that regularly. Have conversations with your staff and, really even hire an independent auditor or someone like myself or other consultants or business coaches who can actually look at this objectively and kind of assess your clinic and help you make that decision about which way you want to sway. The next big thing you can do is ask yourself, why am I choosing X model? Why am I choosing to hire independent contractors? Why am I choosing to have employees? This is something that requires a lot of mindfulness, especially in being a business owner. All things require this. But if you're doing it just because it's easier or because it's what everyone else is doing or because it's the standard, that's not a great reason for it, right? You have to really figure out, is this truly the right fit? Am I wanting to hire independent contractors because I want to create a beautiful facility that people can rent and operate their own businesses out of? Great, let's set you up for that model. If you want to be able to control schedules and have really great branding and team education sessions and have, uniforms, and you want to really integrate everyone and you want to maximize the potential profit of the clinic itself, that's when you might need to look at an employee model. So really, truly ask yourself and be intentional. Which one of these am I choosing and why? And then once you've done it, flesh that out really, really well. Hire your lawyer and your accountant to review everything. If you do decide to go independent contractor, something that you really need to do is document, document, document contracts, document the obligations that your contractor must meet. What are the rental agreement models? What do they have to uphold? What do their invoices need to look like? This is really important to have all these things documented in a contract. Lastly, go look at the CRA website. Go actually investigate this and look it through, right? Like that's your greatest resource right there is looking at the CRA's website, BC employment laws, like study these things mega, 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 because that's like, that's the resource you need there. It's the same. Like you wouldn't go and start direct billing a company without reviewing the terms and conditions. At least I hope you wouldn't. And so why would you create an employment contract or an independent contractor contract without reading the information in the terms and conditions and ensuring you're meeting them, right? So like do your due diligence, read these things. It's super, super important. So again, remember the CRA doesn't care what you call your staff, they care what the actual relationship looks like. So make sure you understand what it looks like and what it truly, truly is. So if you're thinking after this, might need to review some of my contracts, great. That's the whole purpose of this is just to kind of bubble up some of these questions within yourself. And, if you are leaning into employee territory, that's totally fine. Maybe there are some conversations and renegotiations that need to happen, but in the long run, that actually might be a really healthy thing for you. It might be a really challenging, bumpy time to go through some of these contract negotiations again and to remodel. But at the end, it's going to protect you in the long run if you do it the right way. And so, if you're in that position, let me know. Let's chat. Let's see. Like, if you're feeling a little bit gray, let's decide on an actual direction and, create structure for you that works really, really well. So, I would love to hear from you. I'm really curious. Do you have an independent contractor clinic? Do you have an employee clinic? Do you kind of have like a hybrid thing going on? I want to know. I want to kind of gather the data and see what's out there and what exists and what unique models you've come up with. Some people are exploring salary models, hourly models now. Commissioned employee or, independent contractor commission split seems to kind of just be the two models right now. But, if I were to open another clinic, I think I'd be exploring like hourly or salary or, something there in the employee model. Or it would be a purely rent model. You rent the space. I'm going to make this space like so, so, so cool and like beautiful and awesome. And that's my job. And then I'm going to rent it to you and make sure that you get everything you could possibly need to run your business well, right? Like really making sure you lean into either of those. But I'm curious. I want to know. Tell me what your business structure is and how it's going. And, if you want to evaluate yours, let me know. Let's work together. I'm always keen to learn a bit more and to do a deep dive and to learn about this and to help support other clinic owners through this. So I would love to hear from you, danielleboyd.ca, or send me a DM on Instagram. I'm responsive there. And yeah, I hope I didn't scare anyone. And it's funny. I was in a conversation with someone who said they had listened to the podcast and they were like, "Oh my gosh, I don't know what I'm doing." And that is not my intention with this at all. My intention is just to bring some thought and have people reflect on these things and start having these conversations and really to continue to elevate the profession because we know physios work really hard and there's some people doing incredible things with their clinics and really specializing in unique areas. So keep going, keep up the incredible work, and I'll see you in the next episode.